So as you know, that myeloma is a complex disease, and it also has a relapse course. And recently there has been a lot of advancement in the treatment of myeloma, and more novel therapies are becoming available to the patients. So many of those therapies have improved the survival of the patients with this disease. And therefore, it's now very important to also focus to modify and fine-tune some of these treatment in order to improve the tolerance of the patients to the treatment and improve the availability of the treatments, as well as maintaining the efficacy against myeloma. So this is important because nowadays the survival of myeloma treatment have increased, and therefore it is essential to maintain the quality of life for those patients, as well as their tolerability to the treatment. So recently there has been an expansion in the treatment of myeloma that are directed toward the B-cell maturation antigen. So this is an interesting target for myeloma because it is very specific to the plasma cells. And the recent formulations that have been developed targeted against BCMA have the potential to be directed specifically toward myeloma cells. And clinical trial with the current treatment with BCMA targeting have demonstrated a great potential for myeloma treatment. However, those BCMA target treatment can also be affected by certain issues such as toxicity and the availability, as not all of the treatment available nowadays are off the shelf. So you may be aware with belantamab, mafodotin, teclistamab, and BCMA targeted T cells, which are the prime in this field. So my area of expertise is in the design and the development of lipid nanoparticles for tissue-specific targeting. And these lipid nanoparticles, they have the potential to be used as a vehicle to carry the therapy specifically to the disease area. And in my lab, we are working on a different lipid nanoparticles formulations that we use for cancer therapy as well as for brain targeting. So lipid nanoparticles, they have a huge flexibility in terms of the design and also the choice of the therapy to be delivered. And they have also a lot of potential because we know a lot about their safety profile, and they have a potential also for clinical translation. And there are many examples already in the clinic. The majority of those have been developed for cancer treatment, which is not surprising because we know that cancer treatment are associated with a lot of side effects, and therefore it is important to direct these therapies specifically to the cancer tissue to save the patients a lot of the side effects and improve their tolerance to the treatment. More recent examples in the field of lipid nanoparticles are the COVID vaccines, which just demonstrate the huge potential of this approach. In the work that we presented at the International Myeloma Society, we demonstrated the design of BCMA-targeted lipid nanoparticles that, when internalized by myeloma cells, will deliver a payload of MMAF therapy to the cells. So MMAF is a tubulin toxin, which is a small drug molecule that have already been tested in the treatment of myeloma as a drug conjugate, which is also known as belantamab mafodotin, and it's demonstrating encouraging results for myeloma treatment. So with our approach, our BCMA targeted nanoparticle have demonstrated that it has the capacity to be internalized rapidly by the myeloma cells. And as a result of that, this resulted in a significant increase in the toxicity to those cells. So we demonstrated this across a range of myeloma cells in vitro. So it's still early days, but our results are very encouraging, and therefore our plan is to test this formulation on primary cells from myeloma patients, as well as in a clinically relevant mouse model for myeloma. So so this the first-in-class BCMA-targeted lipid nanoparticles for myeloma therapy, and we believe that our approach can have the potential to to save the patients of the target side effects, as well as becoming available off the shelf.